Hi, I'm Dr. Joseph Witt-Doerring, and today we're going to talk about what everyone needs to know how to do before they take a new drug. And this is especially true if you see a physician in a practice that's very busy. Maybe you're in there for 10 minutes and you had a lot of things to discuss, and right at the end, you got around to getting a prescription for something, but the doctor didn't quite have the time to tell you about the risks and the benefits of the medication. Really important if you're taking it for yourself, extremely important if you're going to be a guardian for a small child and you are going to be allowing them to get it. So um, I hope this is helpful. I think it's going to be, and it should help you be a more informed medication user. So I'm going to start by sharing my screen. Okay. So the webpage which you're seeing now is called Daily Meds, and it is a government website that hosts the most up-to-date information on drugs. So let's say, for instance, you are getting a script for Adderall. You would put it in, and let's say it is the original, well, we'll go with the XR formulation. You would click on it, and then you would open up the drug, and you can look at it this way if you'd like to. Maybe we'll do it this way. Sometimes I use the printer version one. I find it easier to navigate. So the first thing that you want to look at is the box, if there's a boxed warning, and that's what this is. This is kind of the most important warning where it's pretty much negligence if your physician didn't mention this to you. This is what everyone should be worried about. So for Adderall, it's, these drugs are addictive, essentially. They cause addiction, they can be diverted, they can be misused. So you need to be aware of that. The next thing, which is usually what you're actually told, is the indication. So you're getting this Adderall for your ADHD. They usually tell you that. Maybe they gave it to you off-label for something else, and in which case it wouldn't be here. And you might ask your doctor, hey, is there anything on label, something that's FDA approved? As I noticed, that when I looked at the drug label, I didn't see my condition in there. So the next thing you're going to want to look at that's really important is the contraindication. This will tell you conditions where the drug should definitely not be used. So as you can see, Adderall shouldn't be used in people with moderate to severe hypertension. And we'll go into that a little bit more in a moment. So you look at the contraindications, and then you go into the warnings and precautions. Now, there can be some medical jargon in here, and that's because the drug labels, they're actually written for physicians. So, but they should still be you should be able to make your way through them. And there is a section in the label later on where things are a little bit more straightforward, but this is the most data-rich section. So you can see, okay, potential for abuse and dependence, cardiovascular reactions. A lot of people do know that. It can cause hypertension, but it's also been known to cause sudden death in some people. Usually that means acute cardiac arrest. It's probably very rare, but the cases that usually back something like this up is, someone with no prior history of cardiac conditions takes this drug, and then 10 days later, they have a cardiac arrest. If enough of those happens, then that looks like a signal for acute, acute death. Okay. So there's some psychiatric adverse reactions I want to look out for. Okay, may cause mania in some people, may cause bipolar-like symptoms, may make me more aggressive or hostile. Now, this doesn't really speak, well, in some cases it does. It can give you some figures, but a lot of the times it won't speak to the frequency. A lot of these things, they're usually pretty infrequent, because for a drug to even make it on the market, it needs to have a positive benefit risk balance at the population level, which means it helps the majority of people. And maybe in a trial of 1,000 people, one person had this manic type reaction. There are individual differences. Some people will have these adverse reactions, but we're not going to pull a drug off the market if it's just one person. So even though it sounds very frightening when you look at it, They may be quite rare, but that still doesn't mean you shouldn't be aware of them when you're taking them, because you never know, it could happen to you. Okay, we have growth suppression in usually pediatric populations with open growth plates. That's something you want to be aware of. Seizures, peripheral vascular disease, serotonin syndrome, et cetera, et cetera. So the warnings and precautions section of the label, these are what the drug company and the agency consider to be the most important risks that the prescriber should know. They may not mention all of them to you, but the prescriber needs to be aware of all of them. Okay, so the next thing that you should go and look at, I mean, if you're pregnant, you may want to look at special populations. They'll talk about the data that has to do with using the drug in pregnant populations. If you're a woman who's breastfeeding, that information is all in there. But the patient counseling information. So this is what the FDA and the drug company think that doctors should be telling people when they take the drug. So if you got rushed out of that visit because the doctor was too busy, you really are going to want to read this, because this is what our regulators think should be shared. So again, you can kind of see, it pretty much will mimic the warnings and precautions. Okay, so let me stop this now. So I hope that was helpful. If you ever feel like you got rushed out of your doctor's office and they didn't have time to give you a comprehensive overview of the medication, please go to Daily Meds, put in the drug there, and then have a read of the label. It will allow you to get the most out of the medication, because and also have the best care, because if you can pick up on some of these problems that are happening early, usually they won't become a big deal, hopefully, and you can pivot to another medication that may be a better fit for you. So thank you for listening, and I hope you enjoyed this.